Imagine this for a moment. You wake up feeling weak, your stomach keeps churning, and you're running to the bathroom again and again. You tell yourself, "It's probably something I ate. It'll pass." And most of the time, you're right. But knowing what to do in those first 24 to 48 hours can make the difference between quick recovery and serious dehydration. Today, we're going to talk about acute diarrhea in adults, what it really means, how to treat it safely at home, when medicines help, and when it's time to stop waiting and see a doctor. Simple explanations, practical steps, no panic. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, medicine specialist, diabetes and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, don't forget to subscribe to this channel for more simple, science-based, doctor-reviewed health videos that help you understand your body better every day. Now let's start with an important reassurance. Most cases of acute diarrhea are caused by viruses. They usually settle on their own within 1 to 3 days without antibiotics. The goal of treatment is not to stop diarrhea at all costs. It's to protect your body while it heals. Let's break it down step by step. 1. Rehydration, the most important treatment. If there is one thing you remember from this video, let it be this. Dehydration is the real danger, not diarrhea itself. When you lose fluid through frequent loose stools, your body also loses salts like sodium and potassium. Just drinking plain water is often not enough. For mild to moderate diarrhea, sip fluids frequently even if you don't feel thirsty. Use water, clear soups, diluted fruit juices, or oral rehydration drinks. Take small sips every few minutes if large amounts make you nauseated. Best practice is oral rehydration solution, or ORS. These are specially balanced to replace both fluids and electrolytes. You can use ready-made solutions like Pedialyte, or make a simple homemade version. 1 liter or 1 quart of clean water, 1/4 teaspoon of salt, 2 tablespoons of sugar. Stir well and sip slowly. For severe dehydration, do not wait. Seek urgent medical care if you have extreme thirst, very dark or no urine, severe dizziness or fainting, inability to keep liquids down. In these cases, IV fluids may be life-saving. 2. Over-the-counter medicines, symptom control, not a cure. These medicines do not kill germs. They simply help you feel better while your body recovers. Loperamide, commonly known as Imodium, slows down bowel movement, reduces stool frequency, useful for mild, watery diarrhea, but it should not be used if you have high fever, blood in stool, because it can trap infection inside the gut. Bismuth subsalicylate, like Pepto-Bismol, reduces stool volume, helps with nausea and cramps, has mild antibacterial effects. Safer if you have a low-grade fever. A common side effect is black stool or black tongue, which looks scary but is harmless. If gas and cramps are bothering you, loperamide combined with simethicone can be helpful. Always follow dosing instructions and avoid mixing multiple anti-diarrheal drugs without advice. 3. Diet. What to eat and what to avoid. For years, people were told to rest the gut. We now know early refeeding helps recovery. Once your appetite returns, start eating small, light meals. Eat more often instead of large portions. Recommended foods include bananas, rice, applesauce, toast, boiled potatoes or noodles, plain crackers, lean meats like chicken. These foods are easy to digest and gentle on the gut. Avoid for a few days. Caffeine, alcohol, fried or spicy foods, sugary drinks, dairy products. Temporary lactose intolerance is common after diarrhea. Milk can worsen bloating and loose stools. 4. Prescription medicines. Only in select cases. This is very important. Antibiotics are usually not needed for acute watery diarrhea. They are reserved for specific situations, such as traveler's diarrhea, confirmed bacterial infections like Shigella or cholera, severe illness with high fever and blood in stool, Doctors may prescribe medicines like azithromycin or ciprofloxacin, but only when clearly indicated. Probiotics may help shorten symptoms by about 1 day in some adults. They are generally safe, but not essential for routine treatment. 5. When you must see a doctor. Do not ignore these warning signs. Seek medical help if you have diarrhea lasting more than 2 days, severe abdominal or rectal pain, blood or mucus in stool, fever above 102 degrees or 39 degrees, signs of dehydration, very little urine, dry mouth, weakness, diarrhea in pregnancy, old age, or chronic illness. These situations need proper evaluation, not home treatment alone. Now let's bring this all together. Acute diarrhea is common. Most of the time, it's short-lived and self-limiting. The smartest treatment is hydration first, gentle food next, symptom control when needed, and medical help when red flags appear. Your body knows how to heal. It just needs support. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, medicine specialist, diabetes and hormone specialist. Information collected from Mayo Clinic, Cleveland Clinic, and NHS UK. If you found this video helpful, please subscribe and share it, because awareness is the first step to healing.